Good afternoon, everybody. Welcome to this briefing, and it's a briefing that's going to be packed with good news, hopefully, in relation to where we are. Because I don't think it's unexpected from the very perceptive population of the bailiwick, and particularly Guernsey, as to what position we're in. We've now had 18 days with no positive cases. So on Monday, the 22nd of March, we're moving to phase 3. Now, why don't you move earlier? Perhaps could be said because you've had 18 days, but this horrible virus can take up to 14 days to incubate, and we've not been in phase 2 yet for 14 days. So we just want to be absolutely certain, because we don't want to move backwards, that all is well. But, I keep emphasising the word but, for us to not move forward to the 22nd of March with phase 3, we'll be needing something quite extraordinary. So we're going to be moved forward on the 22nd of March because we've had cafes and restaurants open, our schools are back, and people have started to resume their lives, businesses are working. Now, we still, though, for the next 4 or 5 days until the 22nd, we still will be in phase 2, and phase 2 rules will still need to be enforced for the reason I've said, the danger about incubation, which is a danger with a small d. Also, of course, we have to have regard to the fact we wouldn't be coming out of this lockdown as quickly as we are without the vigilance, good sense, decency, and overwhelming community spirit of our community. So I and all my colleagues on the CCA, thank you for that, and just keep it going for a little bit longer. And even when we're back and operating next Monday with our internal economy going strong, we're still going to need to just exercise common sense. Not to worry, but because we just want to make sure that we can enjoy the freedoms that we've been restricted in using and we've lost for the last several weeks. Now, there's a galaxy of talent on this panel, as usual, and they'll be speaking to you in due course. Dr. Brink will tell you about the statistics and also something about the AstraZeneca vaccine. Deputy Broad will tell you about vaccinations and where we are. And some people have had concerns because younger people have got vaccines when people wonder why older people haven't. But anyway, his words of magic and wisdom will pervade. Deputy Salisbury will deal with certain of the guidance, etc., that will be necessary post Monday, just giving you good sense, really, as she always does. And last but not least, the Chief Executive, Paul Whitfield, will tell you something about isolation and where we're going to be. So let's continue the good news. From Monday, we'll all be able to enjoy the staycations in those wonderful islands of Alderney and Sark, and they'll be able to come to us. The restrictions about travel between Alderney and Sark, the 14 days limitation, will drop by the wayside. They won't apply as from Monday. So you'll be able to go to Alderney and Sark in the normal ways you would before. Also, in relation to our borders, we're taking this first step. Non-essential travel will be permitted from Monday the 22nd of March. But there will still be self-isolation requirements. The full 14-day period will pertain, and people will have to have negative tests on day 1, day 30. But all of that said, that's where we are. As I say, our sympathies are with the family of the person who died. Our sympathies are with the person who's ill in hospital. And our sympathies are with other people who have suffered considerably as a result of this awful pandemic. But we're getting there. We're moving forward. We're moving back to the life that we should have always sought to enjoy. Anyway, enough from me. As I say, I'm the warm-up act, really, for the 4 stars. So I turn to the first of those, and that's Dr. Brink.
Thank you very much, Deputy Fairbrush. And as always, I'll start off with a summary of our cases. And as Deputy Fairbrush said, today is a really good day. We have now been 18 days with no new cases of infection. So really good news for us. And we're good to go for stage 3, obviously, unless something untoward happens over the next few days. But we're not expecting this. All of the data we have presenting to us is that we're in a good way. So very pleased about that. Just to summarise where we are, we still have 1 active case. That case remains in hospital. And as Deputy Fairbrush said, our thoughts are with that person and their family. That's really important. Overwhelming majority of our cases have recovered. So 510 cases are now closed with 509 recovered. And of course, we sadly did lose 1 person during this wave of the pandemic. Now, I think despite us being in a really good position, I'd like to emphasize again is if you do have any symptoms, no matter how mild, please do come forward. You won't be spoiling any record. You won't be making us go backwards. What you will be doing is helping us get on top of any infection if there is residual infection out there. So really important that you consider if you've got symptoms, come forward and be tested. So if I can go to the next slide, please. So my apologies to the person who's been asking me for surveillance data for 2 weeks, but I'm delighted to say that I have the surveillance data for today. I focused on the surveillance data that we've been doing at the East Arm, so the East Arm Ferry Terminal, and that centre was set up and really has performed beyond expectations. And I'd like to say how grateful I am to that team who have really just taken this challenge on and run with it. So what I'm presenting you today is the data since the 15th of February, so for the last 4 weeks. And this specifically excludes the surveillance data that we do, the testing that we do up at the Princess Elizabeth Hospital. So on top of that, we've done between 2,000 and 3,000 surveillance samples on health and social care staff. So it's really been a very large project. So since the 15th of February, we've done a total of 12,000, just over 12,000 surveillance samples at the East Arm. The overwhelming majority, the majority of those, about a third of those, were done in education. So that was both teachers and certain students as well. Now this has been central to enabling us to get our schools back, and really important because we can do this with assurance, saying that we don't have residual infection in these groups of individuals. Other groups that were important were, of course, the wholesale and retail industries. A lot of these people are front-facing, so it was important that we tested those groups and looked for any infection within those groups. We tested bailiwick law enforcement, other public administrations, just over 1,800 of those being tested, and people involved in transporting goods around the island, so 1,326 tested over that period of a month. So really been a very, very big project. Over that period of time, we've detected a total of 7 cases of infection, and as I'm sure you're aware, these were a mixture of those occurring in education, healthcare professionals, food retail, and bailiwick law enforcement. So it was a combination of everything together. But this surveillance program has enabled us to detect any residual pockets of infection and rapidly control those, and has been central to us moving forward. If we go to the next slide, is what I've tried to do is express this graphically. And you can see over the 4-week period, we've tested roughly the same amount of samples. There's been a bit of a difference during that time. Week 3 being one of the highest times when we tested over 3,000 surveillance samples during that week. The rest of the time between 2,500 and 3,000 samples. Of course, what you can see then is a relative contribution of the different groups of individuals with the predominance of education. And I think that, again, just shows how this testing program is helping us get back to a more normal situation within the bailiwick. So on my last slide today, I wanted to focus on vaccination. And what I want to start by doing, I'm going to talk about the AstraZeneca vaccine, but specifically to look at the heat map that we've developed with regard to the vaccination program. What we've considered is our vaccination coverage against circulating virus and what our aims are. So our aims, of course, are to hit the sweet spot, which is illustrated by that green box. And there what you have is high vaccination coverage and low circulating virus. If we're going to achieve that, we'll really be in a good way. This amber version, or the amber state that we could be in, is if you had high vaccination coverage and high circulating virus, or indeed low vaccination coverage and low circulating virus. Now, we know to date our vaccination coverage has been really good, so we're hoping to maintain that high vaccination coverage. The worst situation that we could be in would be high vaccination or low vaccination coverage with a lot of circulating virus, and that's indicated by the red block. So that's the heat map we work on, where we relate the circulating virus to our vaccination coverage with the idea of hitting the green block. And as I say, to date, we are very, very happy with our vaccine uptake. I wanted to finish by saying a little bit about the AstraZeneca vaccine. And if you look at the situation in the UK has delivered over 11 million doses of the AstraZeneca vaccine. And what they're telling us is that there's no difference in the number of blood clots since the introduction of this vaccination program. Now, as always, I like to look at our local evidence. And so we've looked at our local evidence, and just at our community vaccination centre at Beausejour, we've delivered over 11,000 doses of the AstraZeneca vaccine, and we haven't seen any complications related to blood clots in those group of individuals. So that's really encouraging for us. Then, in addition to looking at local data, we also look at what national and international bodies are saying. Now, what the European Medicines Association are saying is that the benefits of vaccination outweigh the risks. They're, of course, doing a review, and they will publish that either later today or tomorrow, and so we look forward to receiving that review. The MHRA are advising people to go for vaccination if they're called in. Our advice is clear, is that the AstraZeneca vaccine has shown to be effective in preventing severe COVID disease and hospitalization. Data on transmission is emerging now, and prevention of transmission is starting to emerge. Our advice is if you're called in for the vaccination, please do take the opportunity and go ahead for the vaccination. Clearly, if more information comes to light, we will always look at new evidence. We always do, and we will continue to do so. So I think that summarizes the situation with regard to vaccination, but also what I wanted to say is to also thank everyone in the bailiwick, but also in the community vaccination centre, who are doing an absolutely superb job in getting our bailiwick protected. This is key to getting us back to normality and moving us forward. So thank you very much, and I'll hand back to Deputy Fairbush.
Thank you very much. Now, Deputy Fairbush will tell us if the questions have been asked about being called for your vaccination locally. Deputy Broad.
Thank you very much, Deputy Fairbush, and good afternoon. Last week, I updated you all with our latest COVID-19 vaccination figures. Unfortunately, that figure was incorrect. A tabulation error was identified that had resulted in some doses being double counted last week. As a result, on Monday, the published results showed a reduction in the total number of doses of around 3,400. The total number of doses published today is 26,769, and I would like to sincerely apologise for this error. Since our last briefing on Friday, we've continued to see some people commenting on why they've been invited for their vaccine. They're scratching their heads because based on age, their health and their medical history, they don't see how they meet the criteria for the group we're currently vaccinating, which is group 6, which are considered to be moderately at risk. Yesterday, we published a pretty comprehensive explanation as to why this is happening. For those who've not seen it, I'll try and give you the short version now. Identifying those people considered to be at moderate risk isn't a quick and easy job. It relies on a lot of data gathered over time from different care providers, thousands and thousands of patients. We worked in partnership with the local GP practices and their IT providers to extract relevant data for our community. Then, as we worked alongside the UK to deliver the vaccine, we've applied an approved Public Health England algorithm to shift through the data and determined who should be included in group 6. The algorithm goes through the data much faster than we could possibly do manually. But, and this is the but, it's throwing up anomalies, particularly in Guernsey, where we are not applying it to an NHS database, which the algorithm was designed for. We're applying it to our own local independent databases, and the algorithms does what it does, and it's not able to do a bit of interpreting here or making a clinical assessment there. It's looking at codes and then it generates the results. What does all this mean? It means some people being called as part of group 6 that probably don't need to be in that group. It may be because of a health condition you've previously had or medicine you were prescribed that is showing on your records a long time ago. We are not too concerned And for those who have been called, I would like to give you the reassurance that you should also not worry. It's not ideal, but we are moving at such a pace through our vaccination programme that the most efficient and effective thing to do is for those who have been invited to the vaccine, rightly or wrongly, to still take up the appointment and get it done. Many of those who've been called forward as part of Group 6 genuinely should be there. And for those who aren't, you're not really slowing things down significantly by getting your vaccine. In fact, if we stop and try and reassess all the thousands within Group 6, that would really slow things down, and we're not proposing to do that. We've referenced a line from the WHO more than once in this pandemic that perfection is the enemy of the emergency response. So although our call up for cohort 6 may not be perfect, it's probably the most effective way to get Ireland vaccinated, and I do apologise for the puzzlement it's caused. Now, if you really feel you don't want the vaccine yet, that's fine. Just call the number on your letter and explain. They won't oblige you to have it now, and you won't miss out later when we get into the later phases of the vaccine rollout, and you will be called in your age group anyway. While we vaccinate those in Group 6, we're already sending invitations out to Group 7, which is the 60 plus age group. So despite this hiccup, we're still ploughing ahead. Invitations for Group 8, the 55 plus age group, will begin to go out from Monday. And finally from me, one thing I would ask, if you think you should have been contacted as part of Groups 1 to 5, that's all those over 65, and you haven't heard anything from us, please let us know now. And so that's for anybody over 65 who hasn't been contacted, please call us, and the number is 70 76 07. So thank you very much.
Thank you very much, Deputy Bright. Now to Deputy Salisbury, who's going to give us some key points on the rules and guidance the next stage. Deputy Salisbury.
Thank you, Deputy Fairbrush. As we enter stage 3, it will be pretty much back to normal in terms of our everyday lives as restrictions are lifted. The end of bubbles and the end of socially distanced walks. In many respects, it will feel like it did before those 4 cases were identified at the end of January. All pubs and nightclubs will be able to open, and team sports of any type can go ahead. As I mentioned last week, we will be putting some rules in place for gatherings over 100. Just to be clear, we're not limiting the size of gatherings, only requiring that certain conditions are met for them to go ahead. Now, the CCA will be finalising these requirements tomorrow, and we'll be issuing the details on Friday. Now, outside of large gatherings, all the mandatory rules that we introduced for this lockdown fall away. But we do really want to encourage some good habits. The most important of all is to stay at home if you're feeling unwell with any of the COVID symptoms. Don't attend big events, don't go out to the shops, don't go to work. And employers, please don't pressure your staff to come in if they have those symptoms. Instead, please encourage them to report their symptoms and get tested. Let's be honest, after the first lockdown, as we got used to things feeling like normal, how many of us ignored that cough or headache, still went about our day and just left it at that? We got away with it until the end of January, and then we didn't. And as we come out of this lockdown and things feel like normal again, we need to still take this seriously and realise that COVID can return to our community. It's already happened once, and the risk cannot be eliminated completely. Some jurisdictions are now dealing with a third wave. We don't want to join them, and we can avoid it if we all act responsibly. The earlier we pick up cases, the easier it is to manage, and for our track and trace team to do their work. So if you have COVID symptoms, please do get tested. Hand hygiene and social distancing are also good practice that we can and should keep following as much as we can. For queuing up, we should space out. Don't crowd people in shops and supermarkets if you don't need to. And as for face coverings, they're optional in stage 3. We don't expect to see people wearing them all the time, but we do really want you to think seriously about using them anytime you're in crowds, in closed, poorly ventilated places, or just very close to other people. In these situations, it absolutely is appropriate to keep wearing your face coverings in stage 3. And while right now we're describing the use of face coverings as optional, we may up that in the future. There may be times as travel restrictions relax and more big public events and days out are organised that we turn up the advice and say, actually, for the next little while, we really do recommend you wear them. So we want you to keep them in mind as part of what our new normal could look like. And one more thing to add on stage 3 is please be aware we're talking about the rules and guidance for within the bailiwick. What we expect people to do as they travel into the bailiwick by air or sea doesn't change. People will need their face coverings for those journeys. And finally, on that note, I just want to comment on some of the questions we've had about the bailiwick blueprint, which we announced on Friday, setting out our longer term timeline for how we expect to relax and remove those travel and board restrictions between now and July. We are getting questions on what the rules might be in April, May, June and July as those restrictions are removed, but we don't know the details yet. We wanted to give some direction, some clarity on how we think we'll move forward. We know people were crying out for that, but it's still an unpredictable situation and we may need to review the blueprint. Particularly the further into the future we look, the harder it is to be certain because there are so many variables. So I'm afraid we just don't have the details around those future moves to relax our travel restrictions, and it'll be a little while before we do. As soon as we know what they are, though, we'll let you know. And as Dr. Brink has always said, we look at the evidence and make our decisions based on the evidence at the time, and that's what we will continue to do.
Thank you very much, Heidi. And finally, not last and not least, we announced on Friday some changes to the rules for people travelling and self-isolation rules. So our Chief Executive, Paul Whitfield, will now give you an update. Paul?
Yeah, good afternoon. Thank you, Deputy Fairbrush. On Friday, we announced a change to the self-isolation requirements for those travelling to the bailiwick from Monday the 15th of March and promised you more information today. Before I go into the detail, I think it's useful to remind you why the CCA made this decision. We know that the new variants of the COVID-19 virus are extremely transmissible. We saw this in the second wave last month. We also know that in the second wave, high levels of transmission were seen specifically within households and other settings where people lived in close proximity. The only way to reduce the levels of transmission and therefore protect our community is to enforce stricter self-isolation measures where we are thinking of living in circumstances that present a medium to high risk. In this way, if someone develops COVID-19 whilst in isolation, it stands every chance of being contained and not resulting in high levels of transmission, particularly in circumstances where people are living under the same roof but may not be subject to the same isolation restrictions. Self-isolation, as we all know, is not easy and requires separating yourself from physical contact with the rest of the community, including those who you live with, where possible, for a specified period of time. The changes made by the CCA, which came into force on Monday, mean that a person, a family, or a group of travellers arriving in the bailiwick cannot self-isolate in a property where 4 or more separate household groups live within the same shared unit of accommodation, unless there is a separate bathroom for each household and the individual or people isolating can have food, drink and other essential items delivered to them without leaving their place of self-isolation. If you can't meet these new stricter self-isolation requirements, you must find alternative accommodation which does, or you must self-isolate in self-isolation accommodation, which may be a hotel room or self-catering accommodation. For clarification, the self-isolation accommodation must be separate and closed off to any other person and must have a bathroom facility solely for the use of the person or people isolating together, and must not have any shared facilities or areas whatsoever with those that are not self-isolating. Since we made the announcement on Friday, a number of people have contacted us to ask what we mean exactly by household. For these purposes, household means an individual, couple or family or other group residing together in a self-contained unit of accommodation, whether or not that unit forms part of a much larger property. An example might be two people who travel to Guernsey to work and plan to live with other people who already share accommodation. That accommodation may be big enough to accommodate them all, but there are already 4 otherwise unconnected groups or individuals who live in the property. As they are not able to have separate bathroom or kitchen facilities, the 2 people who have just arrived must self-isolate somewhere else for the full 14 days before they can join the household. Full details are available on the website. However, we are reminded during the isolation period, each traveller must remain inside the accommodation at all times, only open the door to receive food and deliveries, but only when the other person is over 2 meters away from the door. And they must wash their hands regularly for 20 seconds each time using soap and water. Not leaving their accommodation at all for the full period of self-isolation, apart from in an emergency or otherwise with permission of the medical officer of health. And as Deputy Salisbury says, as always, seek medical advice if feeling unwell or call the clinical helpline. To be reminded, a representative of the Guernsey Border Agency will carry out at least 1 visit during the period of self-isolation, and there will be further unannounced phone checks throughout the period. If you need to self-isolate in a hotel or self-catering accommodation, you should book the accommodation prior to your travel into Guernsey. For the avoidance of doubt, the States of Guernsey are not responsible for booking or paying for the designated accommodation. The anticipated cost of acquiring self-isolation accommodation will range from £1,400 to £1,700. There will, however, be financial help in exceptional circumstances where travel is essential via the existing hardship fund. Full details of this means tested support can be found on the COVID website, along with the list of suitable self-isolation providers. As I said on Friday, we do not believe that the decision will impact a significant number of travellers. So far this week, all travellers have had a suitable accommodation arranged on arrival with family households, or they've already pre-booked accommodation in a hotel or self-catering unit. We will continue to make contact with travellers arriving this week to advise them of this change and provide them with the help and guidance if they need it before they arrive in Guernsey. I have all purposely been quite detailed again today. However, I must emphasise our self-isolation is one of the most important parts of our protection to maintain our current positive position. These requirements are aligned to our vaccination schedule, and it is anticipated that this requirement will remain in force until the end of April 2021. But this will, of course, be subject to ongoing reviews by public health services. Thank you, Deputy Fairbrass.
Thank you very much indeed, Mr. Whitfield. And now, as we come out of the lockdown, there's no need to hold these briefings with the frequency that we have. If we need to have a break, one of these briefings, we'll have one, because as has been said by my colleagues throughout, we want to give you as much information as we can, as quickly as we can. Everything's got to be open and frank, and if there's bad news to tell, it will be told, and if there's good news to be told. So the next time we intend to have one of these briefings will be on Friday the 26th of March. That's not this Friday, that's in 9 days' time. As I say, if there are any major developments or any causes for concern between now and then, we'll have a briefing. But we don't think we will, because we think we're moving into those sunny uplands that have been referred to by my great hero. So we'll be moving towards those. But again, bear in mind the caution and the wise words of my colleagues. So media, your questions, please. Can you raise your hand in the normal way? Yeah. Kate Prout. Kate, your question.
This is great news, what you've been talking about today, and I don't want to bring in the mood down, but we've got a viewer who's messaged us saying, would you consider another lockdown if there was a further outbreak in an Isle of Man style?
I think we have to. I mean, Dr. Brick would tell us. I think we're doing the very, 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 very best that we can, but I think if we got to 800 or 900 cases and they had community outbreaks, I think we might have to. But Dr. Brink knows more about this and is better able to give a balanced response than I can. Dr. Brink.
Thank you very much. So the whole bailiwick blueprint with the surveillance programme is designed to try and avoid another lockdown. So it was one of the things when we looked at it, we said we specifically want to avoid going into lockdown. And that's why we're putting the surveillance program behind the vaccination program. So we'll look to see an increasingly vaccinated population, and then once our population is vaccinated up to a certain level, we'll start tailing off the surveillance program. So all the mitigations we're putting into place are to avoid another lockdown. And it would only be if we had serious concerns about the health and well-being of the bailiwick, or we had some variant virus that was spreading widely across the island, it would be those type of things. But I am optimistic with the surveillance program, the vaccination program. We're doing everything we can to avoid another lockdown. And I think we were in a really good position.
I agree with that, absolutely. And I think my colleagues are nodding affirmatively too. Penny Elderfield, Penny, your question, please.
Yes, we've had all the guidance today for stage 3 and the various things that continue, such as, optional face masks and the large event guidance. Do you see a time where all of that will go and we'll go back to the normal we had prior to this wave of the virus and, a life free of any restrictions?
Deputy Salisbury.
Well, I hope so, but I think if nothing else, the pandemic has shown us how the importance of being vigilant and knowing and understanding if you've got sickness to make sure that you get tested. I think that'll always be something that would be very useful to have, and also understanding, keeping a social distance, all those things that public health have actually been calling for many years actually, but now we've seen the value of them. The things that we should always have at the back of our mind.
I think we've learnt lessons from that. We'll do that as Deputy Salisbury said. Matthew, your question. Matthew Leach.
Thank you very much. A question for Deputy Salisbury. You mentioned in reference to ignoring symptoms, we got away with it until January when we didn't. What exactly does this mean? Does this mean this could have been the reason for the second outbreak?
No, I'm not saying that. I'm just saying that we did find that immediately that we said that we had those 4 cases, a lot of people reported that they had symptoms at that point. So we know beforehand people weren't coming and getting tested. And so what we're saying is if we might have picked up cases earlier, we don't know. So all that we do know is we did pick up from 4 people who did get tested at that particular moment in time. So what we're saying is, whatever happened, that's what we want people to do. If you've got symptoms, do get tested. Don't worry about being a pain or anything like that. The best thing to do is to get tested.
Thank you. Juliet Puto.
Yes, panel. I've got a slightly two-pronged question here, so if you can possibly be slightly patient with me. You obviously issued a lot of detail yesterday about the vaccination programme and the hoped timescale for when you'll be giving out the vaccination programme, which obviously had phase 2 of the vaccination programme hopefully starting in late May. Obviously, we're hopeful that Guernsey might be able to relax its borders by the 1st of July. That seems like not a very long amount of time to do the entire adult population of Guernsey, so I want to check if that's still looking realistic. And also, looking over the water at our colleagues in Jersey, they're now hopeful of vaccinating all their adults with their first doses by the end of May, so before we even finish our phase 1. So how is that lining up with our timescales?
You've got your microphone, sorry.
We're looking to have the first dose of vaccine given to all eligible adults by the start of July. So we know that a considerable degree of protection is afforded by that first dose of vaccination. I haven't looked at the Jersey or other programs in detail, but I think they were looking at completing the program at the end of July, which again, if you're looking at an 8-week gap between the 2 doses of vaccine is probably relatively similar. So the roadmap, the bailiwick blueprint focuses on getting the first dose of vaccine and the protection afforded by the first dose of vaccine. Bearing in mind groups 1 to 9, which are the most vulnerable of our population, should have received the second dose of their vaccine by the 1st of July. So it's looking at protecting the most vulnerable and then moving on to phase 2 and getting the first dose in to all of those in the phase 2 of the programme.
Deputy Salisbury.
Yeah, I just wanted to add to that. We've always said what we think we can manage, and we don't try and overpromise and under-deliver. and quite the reverse. So what the figures we're giving and the dates we're giving are what we think are reasonable. Whatever other jurisdictions do, well, really it's up to them. They might think that, but we're just looking at what we think we can do, because we're all going to get the same proportion of the supply.
Jim from Ireland FM, Jim Delbridge.
Thank you, Deputy Furbrush. A listener's been in touch who's been at the cardiac care unit in Southampton. They're returning to the island. While they're in Southampton, they've been tested 3 times a week, I understand, while they're there. Now, on his return, he'll take yet another COVID test and then have to isolate for 14 days. Now, he's wondering, is this a bit too much? Could that not be brought down to 7 days? Maybe you could give an explanation for the requirement for 14 days. Thank you.
Thank you, Jim. Dr. Brink.
Thank you. And I do feel for people who have been to the UK for medical treatment and are coming back. It is difficult to do the 14 days, but as ever, we're at such a critical time as we move into phase 3. Our vaccination program is rolled out. We need to err on the side of caution. They might have been tested 3 times in Southampton, but they might then be infected on their way back to us, just for example. Now, what I would encourage your listener to do, if he has specific, or he or she has specific concerns in relation to, for example, their cardiac rehabilitation, is to contact public health, and we then can do some mitigation specifically related to a particular set of circumstances. But we do need to err on the side of caution and keep those 2 weeks of self-isolation whilst we move through our vaccination programme.
Thank you. Matthew Leach.
Thank you very much. Bit of a controversial one maybe, but we've been made aware of a rally planned for Saturday called the Worldwide Rally for Freedom, which has been linked to dozens of similar rallies around the world and the anti-vaxxer movement. I mean, what do you make of this, especially one day before we enter stage 3?
Well, we live in this wonderful thing called a democracy, and I don't mean to undervalue that. People must have the right to express their views, whether we agree with them or not, because that's what a democracy is. So I personally don't see any difficulty with it at all. I'll just go to Paul Whitfield to see if we see any practical difficulties from law enforcement, etc. I imagine not, Paul, but you may have.
Bailiwick law enforcement are well aware of the planned event, and also have indication working with some of those that are involved as to the current likely numbers. And it's felt with current gathering that this can be managed quite safely. But of course, Bailiwick law enforcement will be watching it closely and assisting with a safe event if that transpires.
Thank you. Penny Elderfield.
I know you said that there'd be guidance coming out towards the end of the week for businesses, but just wondering on the rule about gatherings of 100 people, how that will be applied to businesses that accommodate more than 100 people, such as nightclubs or even large supermarkets, and whether there'll be specific rules and restrictions on them.
I'll go to Deputy. I think Deputy Salisbury's made it clear that it is going to be later in the week. Deputy Salisbury.
Yeah, I mean, it's not about restrictions. This is all about ensuring that we have our track and trace team can deal with an issue when it arises, and also with large gatherings, just that concern for this is just up to the end of April. Whilst we've opened up, just to understand what's going on and just to be extra cautious. For some things, it will only require probably just a risk assessment once and then records being kept. But as I say, we are finalising that tomorrow and we'll get the details on Friday.
Thank you. Juliet from the Guernsey Press.
Yes, I was interested to see in the Bailiwick blueprint that we're hopefully going to try and get some on-island variant testing after obviously having some delays earlier this year. We're trying to do some being sent there. I was interested to try and find out what sort of timescales could be about setting something like that up and how much something like that could cost to set up, because it sounds like quite an ambitious venture.
Dr. Brink.
Yeah, so we're looking at whole genome sequencing. We're scoping out both the cost and we know that we can do it technically. So we know we have the technical expertise on the island to be able to do that. So one of the things that we've done during this pandemic is we've developed our molecular capacity and developed local people, which I think is really fantastic, because our offering is so much greater than it was at the start of the pandemic. So that's really positive. So we're scoping out the equipment needed, the costs and so on. As I said, will be whole genome sequencing, and we'll then compare that to whether the cost of rapidly transiting a sample to the UK and paying a premium for that. So we're doing that as a whole package that we can present then to the CCA and the senior leadership team a comprehensive proposal. That should be ready by early next week.
Thank you very much. I'll turn back to the representative from Island FM again, Jim Delbridge. Jim.
Thank you. First of all, thanks to Deputy Soulsby for clarifying a little bit regarding masks. We know that in the past, when it was mandatory to wear masks, there were incidences where, there were incidences where people had the finger pointed at them, there was a bit of verbal abuse, etc. I just wonder if you could, it's the terminology, it's advised to wear masks, it's appropriate to wear, etc., etc. I just wondered, in reference to people who have been verbally abused in the past, if you could just clarify that detail, please.
Yeah.
Well, thanks, Jim. We are saying it is optional. All we're saying is these are the situations where we advise that it's probably recommended, the reasons being in those areas where they're poorly ventilated with lots and lots of people close together, that might be recommended that you wear them, because that prevents a spread. In terms of people pointing fingers, and I really request that they don't. Some people that they can't wear masks, and it really doesn't help the whole spirit of Guernsey together.
Well said, Heidi. Matthew from Bailiwick Express.
Thank you very much. This is one just for clarification, I guess, on our border openings. If we do open our border on the 1st of July, does this mean that people who leave before this date and then return after will negate the need to isolate on their return? For example, you could leave on the 22nd of June and then return on the 2nd of July without the need for isolation.
Well, I see Dr. Greg nodding affirmatively, so that means yes, I take it, unless she wants to add anything. So I think the answer is yes. Thank you, Matthew, for your question. Juliet, your question.
There's been obviously a lot of variant testing taking place across the world now, and I think obviously very nearby to us, we've obviously seen some variant testing taking place in northern France. There's been a concerning variant identified actually just across the water in Brittany, which isn't very easily picked up by standard PCR tests. How much of a concern is something like that, and could that then later affect how we have our relationship with our travel with France?
Dr. Brent.
So yes, we're aware of the Breton variant that's been picked up. We yet to see the full sequence, but just to go back to the principles when we designed our diagnostic testing, we always said that we would never ever target one region of the viral genome, because that then makes your testing fragile to any genetic variation in the virus. So just to summarize, our frontline test targets a region of the N protein together a region of the ORF. We then have a confirmatory test, or a second test that we can use, which targets a different region of the N protein together with a region of the ON for the envelope protein. So we've always used a diverse primer. So what we'll be doing now is mapping back, looking at the areas we target and seeing what degree of genetic mismatch there is, and seeing how our test would pick that up. But because we target multiple areas of the genome, our testing is far more robust. Now, with regard to identification of the Breton variant, I don't think there's data out yet on either transmissibility or virulence, but of course this is all very new, and we will be looking at it in a lot of detail in the days to come. So it's on my to-do list for today and tomorrow. So this is something I will be looking at in detail.
Matthew?
A final question from me, and it's a concern from the member of the public that we heard from. Can you offer any comfort to people who won't have been vaccinated prior to the potential border opening on the 1st of July? Will pregnant women and those at the end of the JCVI list be put in a vulnerable position with travellers freely able to enter?
We're hoping for people to at least have had the first dose of vaccine, and guidance is specifically coming out on pregnant women. That guidance is due imminently from JCVI, and I think we'll see that in the next week.
Okay. The only person I see with a hand up now is Juliet from the press. Juliet, your question.
I'm afraid I've got a few more questions if the panel have a few more minutes to spare. One is a question from one of our readers who, you mentioned obviously talking about people going to hospital in the UK, but I understand people going to hospital in Guernsey before they're admitted are currently being asked to self-isolate for 14 days before going in. Is that going to stay the same situation as we go into phase 3, or could that be relaxed?
Dr. Brink, perhaps Debbie Brewer. I'll go to Dr. Brink first. Yeah, well, your mic's on.
Sorry, I didn't know if Deputy Brewer was going to answer the question. I think Dr. Raby will be looking at all of that as part of the stage 3 guidance. So that will be looked at in conjunction with that.
Thank you. And Deputy Brewer.
Yeah, just to confirm that, yeah, it's being under constant review, and as we move further forward. So, and there have been people coming in recently which have had only 2 or 3 days worth of isolation because they've been checked as being okay from that point of view. So, yeah, it will be reviewed all the time.
Thanks very much. Juliet, your next question then.
It's another one on vaccines, I'm afraid. Obviously, we're progressing very well through the vaccine programme, and it's sounding like we hopefully should have second doses being given over the summer. But I'm also aware of people in the community who are slightly nervous about getting the vaccine, who've been putting off necessarily getting it at this stage because they feel concerned. At what point will they miss out on possibly getting the vaccine if they don't get it, or will it be available hopefully indefinitely into the future for now?
They won't miss out. They'll always be welcome into the programme. If people change their minds, we welcome them back into the programme. We want people to feel that they've made an informed choice and the right choice for them. And so at no stage will we say you've had your chance and bad luck, you're out. You'll always be welcome to re-enter the vaccination programme at any point in time. The only rate limiting step will be what vaccine we've got available, and obviously we don't open a vial of vaccine for one person because we have the AstraZeneca, we can give 12. The Pfizer-BioNTech, we can give at least 5 doses. So that would be the only rate limiting step, is that we'd have to slot you into the clinic. But with regard to re-entering the programme, people are always welcome to re-enter the programme at any time.
Julia, another question?
Just another one on vaccines. Obviously, we've extended the gap between the Oxford AstraZeneca vaccines out to, I believe, is it 10 weeks? I was unclear if we'd extended the gap in the Pfizer vaccine doses or whether that was still only at 6 weeks.
We've retained the gap at 6 weeks for the Pfizer-BioNTech vaccine, which is in line with the WHO guidance and in line with what we presented to the Committee for Health and Social Care. But if new evidence comes available, as ever, we'll look at it and present it to Deputy Broad and his colleagues.
Okay, we've got another question.
And I think I've got one final question for the panel. I'm afraid this one might be one for Dr. Raby, but I think previously it has been said that hopefully as part of stage 3, diving will be able to take place again. Is that still looking hopeful at this stage? Will the decompression chamber be back in commission?
Who's going to deal with that? Deputy Broad's going to deal with that.
Thank you. I think the honest answer is I don't know, but we can certainly find that out for you, Juliet, and let you know what the position is with regard to the barrack chamber.
Thank you very much, Deputy Broad.
Thank you, and I don't see anybody else's hand up, so thank the media for their questions. Thank my colleagues on the panel. Thank particularly to every single resident of Bailiwick who complied with the rules, had to put up with this awful lockdown. Monday beckons, so have a joyous weekend and even a more joyous week next week. So thank you very much, and listen again on the 26th. Thank you very much.